osmotically active itself, or it will be combined with an osmotically active salt like sodium chloride. So it will be surrounded by semi-permeable membranes, which is usually made from cellulose. Drug is pumped out continuously because of the osmotic pressure gradient, and it is more suitable for hydrophilic drugs, providing zero order release. This is osmotic pressure control system. Next is chemically controlled system. In this system, the drug is either mixed or chemically combined with biodegradable polymer that change their chemical structure when exposed to biological fluids. These polymers are designed in such a way that they degrade into biologically safe and progressive smaller molecules as a result of hydrolysis of the polymer chains, and thus releasing the active drug. So this is chemically controlled, chemically designed. Polymers will be there. That is, they will change their structure in order to release the drug. Next, hydrogens. Three-dimensional structure composed of primary hydrophilic polymers having chemical or physical crosslinks, which provides a network structure to hydrogens. So, insoluble because of network structure and provides desirable protection of liable drugs, peptides, and proteins. So, certain drugs like peptides and proteins, it can get deranged or disintegrated when it comes to in contact with unwanted materials. So this has to be protected all throughout and should be released only in the particular area where it has to be released. So this can be brought in by surrounding it with hydrogens. So these are the different types of controlled drug delivery systems. Now coming to the next system, that is targeted drug delivery system. Why targeted drug delivery system is important? Because the conventional drug delivery system can have low half-life, high volume of distribution, low specificity, low therapeutic index, low solubility, low stability, high dose, adverse effects, and low patient compliances. These are the disadvantages of the conventional drug delivery system, and that can be compensated by the targeted drug delivery system. And the ideal characteristic of the target delivery system is that it should be non-toxic, non-immunogenic. It should be physically and chemically stable in vivo and in vitro. They control the drug distribution to target cells or tissues or organs. Must have uniform capillary distribution, convenient and predicate rate of drug release. Drug release does not influence the drug action. Curative amount of drug release, minimal drug leakage during transfer. Carriers used must be biodegradable or readily eliminated from the body without any problem, and no carrier-induced modulation of the disease would be there. The preparation of the drug delivery system should be easy or reasonably simple, reproductive, and cost-effective. So these are the ideal characteristics of a targeted drug delivery systems. That is, the main thing which you have to always keep in mind is that this in targeted drug delivery system, what is happening? Actually, the medicine is being binded to some ligands or proteins, and this is going to go to the specific target site and is going to be released there. This is going to happen. So the thing which is going to carry this particular drug to the body should be non-toxic, non-immunogenic. It should have a uniform capillary distribution. It should have the predictable rate of drug release, and it will not cause any kind of, it should be biodegradable. It will not cause any accumulation in the body or toxic accumulation in the body. So these are the basic important characteristics of the targeted drug delivery system. Advantages is that drug delivers releases over extended period of time. Intermittent dosing can be avoided. Improve patient compliance. Reduce inter and intra-patient variability. Drug can be administered in a smaller dose to produce the desired side effect. No peak and valley plasma concentration. Toxicity is reduced by delivering drug at the target site. Self-administration is possible. Enhanced absorption of the drug is there. These are the advantages. Disadvantages is that requires a skill in manufacturing, storage, administration, diffusion and redistribution of drug release, rapid clearance of targeted systems, maintaining stability of dosage form is difficult, highly sophisticated technology requires for formulation, it is expensive, is comparatively very less. So these are the disadvantages of the targeted drug delivery system. Most important disadvantage is the cost. Now coming to biological processes involved. It is like the cellular uptake and processing, transport across the epithelial barrier, extravasation, and the lymphatic uptake. These are the biological phenomena that happens in the targeted drug delivery system. That is, this has to be, the cellular uptake should be there, and it has to be processed. Then it should cross across the barriers, epithelial or biological barriers has to be crossed. Extravasation should happen in the concerned area, and lymphatic uptake or lymphatic clearance should be also there. These are the four major biological phenomena that has to be considered when you are giving a targeted drug delivery system. The two main areas of targeted drug delivery system is tumor targeting drug delivery and CNS drug delivery. These are the two areas where the targeted drug delivery system has got immense opportunities. The first thing is we'll see is CNS related drug delivery system. We have three broad classification of CNS related target delivery system. That is invasive approaches or neurosurgical approaches, non-invasive methods, miscellaneous techniques, or intranasal deliveries. So invasive approaches or neurosurgical approaches include intracerebroventricular infusion, convection enhanced delivery, intracerebral injections or implants, and disruption of the blood-brain barrier. Non-invasive techniques include prodrug, drug conjugate, or colloid techniques such as nanoparticles or liposomes, and miscellaneous techniques include intranasal deliveries. We'll see first what prodrugs are. That is a particular drug that is which is lipid soluble, which can cross the blood-brain barrier, could be introduced into the brain. There, what happens once it reaches a specific site, it changes into, or chemical modification will occur biologically and becomes the main drug which has the effect in the particular site. This is the prodrug. That is, it would be in a different form. Once it reaches a particular site, it will transform into the main active ingredient and it will cause the effect. This is a prodrug. So, the prodrug is also used to improve the gastrointestinal tolerances, increase systemic availability, improve solubility, taste, and shelf life. If something is which is having a high distaste, has to be given to a patient. So what happens? We give it into a prodrug form, which is not that much causing distaste or intolerance. So once it reaches a specific site, it gets converted into that corresponding drug and it will cause the action. This is there. This is the concept of prodrugs. Next, drug conjugates. It involves caging of the compounds within glycosyl, maltosol, diglucosyl, and dimaltosol derivatives of the cyclodextrin. Therapeutic complex is comprised of an omega-3 fatty acid such as alpha-linolenic acid, eicosapantonic acid, and their derivatives. So this will be like, it will be encased in something which gets dissolved once it reaches the specific site of action, and the corresponding inner ingredient will be able to act on that specific site. Nanoparticles. This is the most developed form of novel drug delivery system. They are micronized solid colloidal particles prepared of polymeric materials ranging in size from 1 to 1000 nanometer, used as carrier systems in which the drug is dissolved, enwrapped, encapsulated, adsorbed, or chemically linked to the surface. Liposomes are colloidal vesicular structures composed of one or more lipid bilayer surrounding an equal number of aqueous compartments. A free drug injected in bloodstream typically achieves therapeutic level for short duration due to metabolism and excretion. And drug encapsulated liposome achieves therapeutic level for long duration. And they are biodegradable, essentially non-toxic vesicles, and can encapsulate both hydrophilic and hydrophobic materials and are utilized as drug carrier in drug delivery system. Because most of the cell membranes, as we have studied or seen in the Sneha Kalpana, or membranes are always lipophilic. So they have a high affinity to liposomes. If it is in the liposomes, or if it is in the encapsulated form or vesicular encapsulated form, lipid bilayered form, then they can easily dissolve in the cell membranes. Even the blood-brain barriers and CNS barriers are soluble for lipid layers. So when a particular drug has been encapsulated in lipid bilayers, it can cross all these areas and can and it is also biodegradable, and it can act very well in the concerned area where targeted action can be given. In tumor targeting drug activity, we can divide them into active targeting and passive targeting. So what happens in active targeting is that it attaches ligands such as antibodies, peptides, vitamins, aptamers, or small molecules by a variety of conjugation chemistries to the surface of the nanocarriers, and they bind them or they bring them to the specific receptors on the cell surface. The targeting ligand bind with the receptors first, followed by endosome formation with enclosure of ligand receptor complex by plasma membrane. The endosome is then transferred to the specific organelles and drugs are released by acid pH or enzymes. In passive targeting, it exploits natural conditions of target organ or tissue to direct the drug to the target site. Drug delivery in tumor cells where the leaky vascularization coupled with poor lymphatic drainage serves to enhance the permeation and retention of NPs within the tumor region. So this is regarding passive targeting. That is, in passive targeting, what happens? The natural conditions are exploited. While in active targeting, a compound formation is formed and it reaches a specific site and action is happening. So this is active targeting. Some conditions like overexpression of receptor at tumor acidity, hypoxic tumor environment are utilized to target chemotherapeutic agent to the tumor cells. Okay, so the main mechanism behind active targeting is the recognition of the ligand by its target. If it is a hypoxic environment, and which is a ligand or a receptor which is more good for hypoxic environment can be given along with the chemotherapeutic agent so that it gets attracted to that particular area receptor, it gets binded there and the drug would be transmitted there. So this is how active targeting happens. Okay, a representative ligand would be taken as per the condition. A representative ligand, which can be an antibody, a protein, peptide, would be taken, and in that ligand we will attach our corresponding active ingredient and we'll give into the body for active targeting. In case of passive targeting, what happens? The corresponding the structural problems or issues are being exploited for the use. That is, in case of this thing, tumors itself, we all know that pathophysiology will be that it will have a leaky vasculature. So, based on the drug accumulation in the areas around the tumors with leaky vasculature, that is, when the vasculature is leaky, these can very easily penetrate these tumor cells and can reach to the tumor site and cause a specific action. Enhanced permeability and retention effect provide accumulation of nanoparticles at the tumor site at high concentration due to pathological differences between the normal tissues and tumor tissues. This phenomena is called as passive target. That is, the problems of the environment is specifically targeted there. Pathophysiological environment of tumor tissues differ from normal tissues, leading to EPR effect, which is utilized for the targeted delivery systems. Irregular tumor vasculature structure and lack of lymphatic recovery system in the solid tumor provide high drug concentration at the tumor site. Role of lymphatic system and passive tumor targeting are inside of the tumor tissues. No functional lymphatic system will be seen. Pressing force from the growing tumor cells and lack of internal balancing pressure cause the collapse of the tumor lymphatic system, which causes retention of high molecular weight molecules in the tumor. This specific problem can also be targeted with the help of ligands, and such environment, natural environment that has occurred due to the pathophysiology can be exploited for introducing medicines into these areas. So this is passive targeting. So with this, we are coming to the end of novel drug delivery also. So the basic thing which you have to always understand in novel drug delivery system is, first you have to understand what drug delivery system is. What are the basic different types of drug delivery system, that is conventional drug delivery and novel drug delivery system. Of novel drug delivery system, what are the advantages of each of them? What are the disadvantages of each of them? And coming to novel drug delivery system, what are the two major novel drug delivery system that is existing now? That is, one is controlled drug delivery system, the other one is targeted drug delivery system. In controlled drug delivery system, that is in specific pace, it is a pre-programmed plan, and in a specific pace that different things are being introduced. The required amount of active ingredients are being introduced into the blood, which will cause the corresponding effect in your body. And there will be advantages and disadvantages that has to be noted too. In targeted drug delivery system, two ways it can act: active targeting, passive targeting. And active targeting, what happens? We are externally using a ligand which goes and attached to a particular receptor in the corresponding area. So in case of tumors, we know that that condition, that area will be hypoxic. So a hypoxia related ligand can be chosen in which we attach the corresponding molecules, corresponding active ingredients along with this ligand, and we introduce into the body. So this will exactly go and attach to the tumor sites, which is hypoxic. Then this particular active medicine can have its effect on that particular area. So that is one way. In passive targeting, what happens is that the natural environment, the natural pathophysiological environment will be exploited. You know that the tumor cells will have a leaky vasculature. It will have a lot of association of lymphatic vessels. Supply would be less. So these things we know. So correspondingly, to exploit such conditions, or medicines will be introduced so that which could pass on these areas and get into these areas and act accordingly. So this is passive targeting. So these are the two types of the targeting drug delivery system. So with this, we have come to the end of this topic also. So this is a PG topic, whereas the other one EPA A5 is a common topic with both UG as well as PG. So with this, we are coming to the end of today's class. If there is any doubt, you can ask. Thank you.
खोल रहा हूँ